Maternity and neonatal care is a critical part of healthcare. Both mothers and newborns need specialist care, and with 700,000 births in British hospitals, they make up a significant proportion of patients. Providing the right care requires the right mix of best practice, well-trained staff, and the best equipment possible. For such vulnerable patients, we need to invest in new technology to promote healthy births, to diagnose any problems, and to manage departments effectively. While some advances rely on advanced new systems, some are simple, cheap, and able to make a difference to millions overnight. Over the next half hour, we'll talk to 3 companies who work with mothers and newborns and discuss how they see their contributions to the maternity department.
Innovation is all about a change which brings about value. So whilst we've got innovative technology that can monitor really small changes in blood flow on tiny newborn babies, it's also about integrating that technology into a product which will fit naturally into the care pathway, which will benefit doctors and their patients, but also save costs as well. And we've done a lot of research to determine how the product should be produced at the right cost, how it should work ergonomically with the doctors and patients in mind. And we think that combining high quality and the latest technology with that research will make our products innovative and really benefit the healthcare system. Patient monitoring is extremely important in the healthcare service today. Having the right information, reliable and accurate vital signs and other information is extremely important for managing patient conditions. 10% of newborn babies need some form of stabilisation or resuscitation at delivery, and heart rate is the best guide of how well that resuscitation is going. So monitoring that clinical parameter is of extreme importance.
The whole arena of resuscitation monitoring was really identified to us by Dr. Don Sharkey, a neonatologist who works at Queen's Medical Centre in Nottingham and is an associate professor at the university. 10% of all babies born require some form of intervention at birth. That can be as little as a puff of oxygen to full resuscitation.
Neonatal monitoring is different to typical patient monitoring because firstly, the patients are very small. They can be very physically weak, particularly babies that need stabilisation at birth. Their blood pressure can be very low. They can have very poor perfusion. And therefore, the sizes of the signals that we're detecting are much smaller than they would be in an adult. Therefore, the instrumentation needs to be a lot more sensitive. But also, neonatal patients can't provide feedback on the comfort or other aspects of the monitoring solution. And therefore, we have to be extremely careful how we design the monitoring solution so that it doesn't harm the baby and provides the right information to the doctors at the same time. New products are adopted into the NHS based on their value. So the NHS obviously has a limited budget. It can't spend any more. So the question that a healthcare adopter is going to ask is, can I get improved patient outcomes at the same or reduced cost, or can I get the same patient outcomes at a reduced cost overall? And if the answer to either of those questions is yes, then the new technology could be adopted. But then it's obviously up to the individual trusts, the individual doctors and procurement chains within those trusts to determine whether that product is going to be right for their institution.
A partnership with the university is key to the success of many of these projects. Again, Tioga has had a long relationship with the university and developed lots of ideas and concepts, and working with the technology transfer system that they have here at the university, we've been involved with looking at various aspects of new developments that have come through, and the centre is very much focused on bringing on new developments and projects and commercialising those and getting them into business, hopefully making success, financial success, for the university and any partners that they work with through technology transfer programmes.
The healthcare sector in the UK today, really in terms of maternity care, is undergoing quite a lot of challenge and change just now. There are a general shortage of midwives, there's centralisation of services, and all of these things mean that women don't always get the level of care and attention that would be absolutely optimal to them. Now, that doesn't mean to say that's the case in all of the NHS. There are some wonderful places doing some really fantastic work, but we can't ignore either that there definitely are some challenges. Medical devices and products are really one of the foundations in preventing illness or promoting wellness. And the CUB is really a product that promotes wellness, and because it promotes wellness of the mother being upright and mobile and active, it decreases the chance of many common complications. And as a healthcare professional, I very much believe that a major part of our role is to promote wellness and well-being, to avoid any problems from arriving. It's fantastic when we have services that if you do have a problem, they can respond to that, but it's much better for everybody to avoid the problem in the first place. Many women during antenatal classes learn about birth positioning, but it's still very much seen as a nice to do, and it's not a need to do. I would always assert that because of the positive outcomes, it really is something that all women need to have as part of their planning for their labour and birth. The idea that they are going to be mobile, that doesn't mean to say that they can't or shouldn't have an epidural if that's what they choose to do, but even in those circumstances, they can still change position and move about. They're not completely paralysed from doing things. So antenatal education is one way that women learn. The internet and the media have a huge part to play currently for women learning about how important birth position actually is. And I know from studies that we've done ourselves that most women feel, other than avoiding a caesarean section, the most important thing for them in labour was being able to move about as they want. But in a lot of hospitals, the only thing in the average labour wardroom is a massive hospital bed and a chair for the partner. So if you want to move about or kneel, where are you going to find that's comfortable? What are you going to use for that? And that's why it's important that we do provide resources that give women more choices and options.
In every department, the patient always has to come first, especially when those patients are mothers and babies. The same is true of new products and innovations. The well-being of the patient needs to be the focus of new developments. There are many different approaches to development and many different ways to reduce complications and facilitate treatment, but the goal is always to improve care and deliver real improvements.
In the UK, there are around 800,000 births a year. Around 11 or 12% of them, roughly about that, are elective caesarean sections. So obviously if you're going to have an elective, a planned caesarean section, not an emergency one, then the CUB might not be something that you're going to use. So if you had to look at taking that number out, then you're talking about somewhere between 600 and 700,000 women a year that could benefit in some way from having access to the CUB.
When a baby is born which requires resuscitation, three things happen. It is popped into a plastic bag, a little woolly hat is put in its head, and the clinician will apply a stethoscope. Heart rate is the most important measurement in working out the resuscitation care pathway that the clinician will need to apply. The problem is that the stethoscope is a pretty clunky instrument. It's the gold standard as far as this is concerned, but in many occasions clinicians get the mathematics wrong when they're trying to get a heart rate, and of course whilst the heart rate is being taken, there is no way that any other activity can take place. Thus was born the idea of the Sure Pulse sensor to create an ability to get a heart rate, show it on the screen so that the clinician could effectively do away with his stethoscope.
Yes, there definitely are a lot of challenges in the NHS today, and nobody would deny that. But we also, that shouldn't stop things from progressing. You know, we can recognise the problems, recognise what we do well, and work towards making everything better together. The NHS is facing a lot of challenges today. Resources, staffing, budgets, pressure in services. These are all things that as a society we are responsible for and served by. So we actually I think as a company have an obligation to certainly make sure that any product we're supplying into the NHS is firstly usable, affordable, disposable. That's an important thing to us as well. And actually does what it says in the tin, it actually does work.
There are a lot of pressures on the healthcare industry at the moment, with an ageing population, chronic diseases, heart disease, diabetes, etc. There's a real strain on the health service at the moment, and the funding of any new innovations that come along are proving to be difficult. A lot of the different health authorities take a very different view on how they receive and promote new technologies, and it's very difficult for businesses to get involved with that. The time it takes and the money it takes to bring new projects and ideas and innovations through, clinical trials, development of the product, liaising with the medical staff, it's a very time consuming and a very expensive exercise. And it's very difficult for businesses with new ideas to get into that industry, and it's very hard work.
We're looking to improve our optical vital sign monitoring solutions. One of the key challenges in the industry at the moment is provision of reflection mode pulse oximetry. No manufacturer currently has a solution for patients that are less than 10 kilograms in weight, and that's something that we're looking to address.
Different regions have different views on new innovations and how they get into the hospitals and the healthcare industry. It's very much controlled by finance. We have to prove that any new innovations are cost effective, that the products do what they say they're going to do in the most cost effective manner. And proving that and bringing on the health authorities and working with them is very challenging for any small new business. There are some very large companies in the medical field, and obviously they have a long track record and the financial and technical resource. But for smaller companies to start innovating new products for the health service is very challenging, and one that you need to understand when you enter into it.
There are some challenges in marketing a product to people that share being pregnant in common. Firstly, people have to feel that, you know, is this a product that's going to benefit them? And that might require a bit of education around why birth position is so important. Women are very open though during pregnancy to learning new things, finding out about new things, considering new experiences, because certainly when you have a first baby, it's all new. So you're quite open to new ideas during that time. So that's a real positive that's helpful for us. But of course, there is that side of education. So we provide a lot of resources on our website and in workbooks for people and posters that really just highlight the benefits. Certainly all our leaflets have links, have references and little summaries of research on why different birth positions are really important, because we also feel that grown women are perfectly capable of understanding research. There is no reason that they shouldn't have the same access to that as healthcare professionals. And again, that was part of the product development. We went from having a professionals leaflet and a parents leaflet to now having one combined leaflet that is understandable by everybody.
Maternity care has definitely suffered from some of the cutbacks that everywhere in the NHS the cutbacks have been quite severe, and I think that it's one area where we have to be really, really careful, because each woman, if she had the support of a midwife during her labour, and this is across the world, this isn't just the cutbacks that we're seeing in the UK, but across the world we're a great shortage of midwives, and if we had women with midwives, then the outcome of their childbirth would be so much better. I think the cutbacks that we're seeing impacts on the care women are having, because midwives are maybe looking after 2 or 3 women at a time. That's certainly in the UK. We know that there are huge shortages of midwives across the world. But in the UK, and if you're looking after 2 or 3 women, then you're certainly not giving that individualised care that each woman deserves.
In terms of challenges that we are facing in healthcare today, I think there is, particularly maternity care, issues around women being less fit, more complex labours and births, a higher caesarean section rate, more intervention in birth, and we have, you know, problems with more medical problems in pregnancy as well, diabetes, obesity, more complex cases, and that can be very challenging for the NHS to deliver a service or facilities or resources that meet the needs of very diverse groups of people. The CUB was created because, as a midwife myself, I felt that we were quite limited in the resources we could offer women that would encourage optimal outcomes during labour and birth. And optimal outcomes are very dependent on women remaining active and mobile and upright. And in the NHS we had really 2 things. We had a gym ball, commonly called a birth ball, but it is in fact just a gym ball. And they were never designed to be used for labour and birth. And they're super if you've got use of your legs, if you can balance, if you can concentrate. But of course, they have a limited use as well, because nobody can give birth sitting on a ball. You have to move at some point. The other alternative we had were rigid plastic or metal birth stools, which have other issues around causing venous congestion, increased blood loss, perineal trauma, because their hard edges inhibit venous return. So really I looked at the 2 things that we had, and I thought, well, one is really good for helping women give birth. One of them is really good at helping women be upright. Individually, they can't both do everything. So it just seemed to be an obvious solution to develop something that would meet those needs in a simple way.
It takes more than just the right equipment to run an effective maternity department. A critical part of all treatment is ensuring that doctors have up-to-date records so they can make the right decisions. Complications during birth can be life-threatening, and clinicians need instant access to the right data. This makes records just as important to ensuring that mother and child are both healthy and safe.
We've improved monitoring technology by designing extremely highly sensitive, low noise, optical vital sign monitoring solutions. A lot of optical solutions work well in healthy adults or in adults with good blood supply, but they don't work well in newborn babies who have low blood pressure and who have poor perfusion, particularly to their extremities. So we've improved vital sign monitoring by designing low noise, high quality sensors which provide accurate and reliable readouts in these vulnerable patients. Healthcare equipment needs to be easy to use to reduce any errors that may come about through misuse of the equipment. It's amazing that some healthcare products enter the market that on the face of it may seem easy to use, but actually when you observe them in use in the clinical care pathway, you see mistakes that clinical staff are making that may lead to patient mismanagement, and that's an unacceptable situation.
What really makes the CUB innovative is going back to the simplicity of the product. Although there is of course more engineering and design in it than people would imagine, but the concept is quite unique. It doesn't require a lot of education or knowledge to use it. It's really about being a tool that women can use in the way that they want to use. It's not something that is done to people. It's not something you can't use without somebody supervising you. So it's very much about the woman and her needs and her comfort as opposed to anything else, while giving her the advantages of being able to relax in positions that are going to be optimal for her and her baby during labour and birth. The CUB can be used by women in late pregnancy at home to help certainly with lower back pain, help encourage the baby to be in the easiest position for it to be born.
It can be a challenge bringing together doctors and product engineers, but if you find the right clinician who's passionate about improving patient outcomes and you have the right technology to be able to address that, then there can be an amazing synergy between the two of those that can really work well together.
I think the biggest priority for the NHS customer is value for money, efficacy of the product. Does it actually work? Does it make a difference? Affordability as well. Can we afford to provide this for people? I think those are probably the main priorities. And of course, but not last, of course, safety. You know, is this product going to cause anybody, could it possibly cause anybody any harm? The NHS actually runs an innovation and technology scheme and is quite open to any product that they feel will improve patient outcomes, will decrease costs, will be easily accessible. Yeah, I think the NHS are very open to looking, and if you think of the millions of types of different products used in the NHS, every one of them was a new product at some point. So I don't think they are particularly resistant to it. I think they have to be careful, and rightly so.
The industry at the moment is not very willing to take risks on new products. It's a catch-22 situation where where healthcare institutions need to take risks in order to survive, but because of the pressures on the system, the pressures on staff, on finances, it's very difficult for them to take risks. In the USA, they adopt much more of a risk management approach where they say, well, actually, we have to try this new product to see if it will reduce costs across the healthcare institution, but we don't see that same willingness to take risks, not to compromise the clinical safety of the patients, but to think, well, if we did try this technology out, might it reduce costs? But how do we know unless we give it a go?
I believe the health service will have to change dramatically in the coming years. It's very controlled by the lack of finance at the moment, and that's unlikely to change. Each authority needs to work together to provide the best practice over the whole of the country, and new innovations will have to be taken on to better improve the standard of service and the quality of service that's required for the customers. The ageing population and chronic heart disease, diabetes is a substantial drain on the health service, and any new innovations that come about to help this will obviously make a big difference.
The whole healthcare industry has always been forward-looking, ready to embrace the latest innovations to improve patient care. Neonatal care particularly has always been a speciality, making use of the latest advances in medicine. But there's a real challenge in trying to bring cutting-edge technology into widespread use. Systems need to work together and be reliable enough for long-term use, as well as meeting stringent standards of privacy and auditing.
I think having worked in the healthcare market for a considerable number of years, I do feel that, and based around small businesses trying to enter into that, I do really feel that more could be done to support new innovation in the health service. The entry level to new development is extremely difficult.
The NHS is full of medical devices. These are all things that people have invented or ideas people have come up with. And that's not going to change. And certainly moving into the future of healthcare, innovation and change is the key words. It's certainly not something that's going to go away, and it shouldn't. Because if we didn't innovate and we didn't learn and we didn't introduce new devices, we'd still be doing in healthcare what we did 500 years ago. So innovation is actually about the future and development.
I think the simple product that the NHS wants to buy is sometimes they can't see the wood for the trees, is because they think if you don't pay a vast amount of money for some high technology aspect, it can't possibly work. Now, we absolutely know that the CUB was asked for in Sierra Leone after the Ebola outbreak, and that was essential to help women to be upright so they'd less need for any intervention. If we could reduce that intervention, and you can reduce it by 29% if you encourage upright birth. So it was thought in Sierra Leone that the best way to encourage the upright birth was to invest in a very, very simple CUB. And so I think I think we always look for the highest technology, and if we could just look for the simple things, then that would be brilliant.
In the future, we hope that the CUB will just have become a standard piece of equipment that people expect to have access to. We would like to facilitate the use of the product in countries where they don't have resources to access things like the CUB themselves, and it has certainly been used in a refugee camp in South Sudan by Médecins Sans Frontières. It's also been used in a hospital in Malawi and in Sierra Leone. We would like to look at ways as the business develops and grows of introducing the product for women that really do need any help that they can get. And the massive advantage the CUB has is it's not going to break down. It's not technology. It doesn't matter what language you speak, you're going to understand how to use it. So it has a huge advantage, and it can be easily cleaned, and it's very lightweight, only weighs 2 kilos.